Welcome to ChiroSphere, where we talk about all things chiropractic and some things, well, not so chiropractic. I'm Dr. Ray Foxworth, your host for ChiroSphere and CEO of ChiroHealth USA, the network that works for chiropractic. Today, we're joined by a true leader in the world of chiropractic care and healthcare innovation. Dr. Jason Jaeger is a doctor of chiropractic, healthcare executive, and former CEO of Advanced Spine and Posture in Nevada. With over 25 years of clinical experience, he specializes in musculoskeletal rehabilitation and chiropractic biophysics. Dr. Jaeger has held influential leadership roles with the National Board of Chiropractic Examiners, the International Chiropractors Association, and the World Federation of Chiropractic. He's also an inventor, published researcher, and national lecturer who is deeply committed to advancing whole person health and driving meaningful reform in chiropractic policy. Welcome to the podcast, my friend.
Thank you, Dr. Foxworth. How are you today?
I am well, absolutely well. Let's just hit the ground running. How about that?
I'm ready.
All right. What got you into chiropractic in the first place? Whose fault is it?
That's a great start. Thank you. My mentor, a dear friend of my mother's, her name was Dr. Stephanie Youngblood. And Dr. Youngblood was a Michigan native, a life grad, planted her roots in Las Vegas, Nevada. And I was busy in my undergrad degree at UNLV working towards being a lawyer. Um, I had a funny job growing up in Vegas. Vegas is a different community than
You think?
than the rest of the country. It is and it isn't. Like our suburbs are our suburbs are no different than Southern California or Phoenix. It's hard to tell which one you're in. But we have this funny thing called the Strip, and so I could have done construction in college. I could have been a waiter in college, but instead, I decided to be a jousting sword fighter at the Excalibur Hotel. And
Wow.
I'm I'm on my way to work to go joust, and it's Thanksgiving evening. I just finished having Thanksgiving dinner with my family, and as I'm approaching the Strip in my new little pickup truck that I bought with my own dollars from my own work, um, a sweet little old man pulled across the highway in a Gran Torino and then dead stopped in lane number one. And I plowed into his front axle doing 45 miles an hour. And I got really hurt.
Wow. That's a
So
pretty common path.
yeah, it is. And, it's funny because after the fact, my mom saw a chiropractor, my grandfather saw a chiropractor here in Vegas. And I don't know why I'd never seen a chiropractor. My parents didn't bring me. Well, so I went to work that night and I fought two shows and I didn't have a pickup truck anymore. So my friends brought me home and I went to bed. And when I woke up, I couldn't move.
Yeah.
And I wasn't paralyzed, but I couldn't move. I was in so much pain. I didn't know what to do. And so what does any young 18-year-old boy do when he doesn't know what to do? Call mommy.
Called-
Yeah. Yeah, and mommy said, "You're going to see a chiropractor," and I was already in a lot of pain. I might have been whining, and I might have started crying. I'm like, "No, they're gonna."
yeah.
But that was my path, and Stephanie looked at me and said, "Well, I see what's wrong. You got in a car crash. You went head on to this axle, and the normal anatomy of a neck curve is like this. And you likely had a whiplash, an acceleration deceleration injury. Your neck looks like this. So we're going to do chiropractic on you and get your symptoms under control. Then we're going to do chiropractic on you and we're going to fix you. We're going to correct you, and you'll be good as new."
Awesome. And I'm assuming she delivered, and here you are.
Yeah, she delivered, but there's an interesting side note, Dr. Foxworth. When we were done, she said, "All right, how do you feel?" And I said, "I feel better." And she said, "Boy, do you look better." And I'm like, "I think I'm better than I was before from chiropractic." And I'd already decided I was going to be a chiropractor. But I said, "Dr. Youngblood, one thing, you said my neck curve is this, but it should have been like this. And you did this on me. And you were pushing it in the right direction. When you do my discharge exam, we take a new x-ray." And she said, "Well, why would you need to do that? You feel better, don't you?" And I pressed on it and she took the x-ray and my neck curve was still straight. That ended up changing my life, that moment. So my whole career trajectory, my inventing, the research I published, my lecturing career, my practice, everything was based on that defining moment.
Yeah, that's really interesting. Over the years, we've all had that back in the day when we did a lot of pre and post X-ray. I know a lot of people still do, especially in the CBP community. But that's always kind of been a challenge, I think, for us chiropractors is we tell people they got a reverse cervical curve or you've lost the curve in your lumbar spine. We treat, they feel better, but man, there's nothing like showing a before and after. I mean, because based on what you said, her premise wasn't correct. You know, there was no physical change at that point. Maybe over time it might have been with the CBP protocols, but um, yeah, I think we hang our hats on some things sometimes, and maybe we find out later maybe that's not it.
Yeah. Yeah. And thank God for science and research and clinical practice and all the things that continue to grow our knowledge base.
Yeah, no doubt about it. We're a staunch supporter of it. We, as a company, support the Clinical Compass and NCMIC's foundation and others. Unless you've been before legislators and hearings and workers' comp hearings and in that world, and you get asked, what about the science behind chiropractic or the research? You don't really fully understand just how important it is. Otherwise, you're just arguing opinions,
That's right.
and it really makes a challenge for it for us that do get involved in advocacy. So I understand that you got involved in Medicare reform while you were still in chiropractic college. What
I
sparked
did.
that passion so early?
I did. So interestingly, it's so odd, but there's these things that you decide you want as a kid. And as a kid, I wanted to be in Congress. I have no idea why. But it just attracted me and that was not normal. So I didn't do student government in high school or in undergrad, but when I got to chiropractic school, I had an opportunity to run for class representative. And I just something triggered and I said, here it is, here's my chance. And so I ran for student rep. I went to LACC. It was not SCU at the time. I went there because I wanted to figure out this neck curve thing. And as I toured the chiropractic schools, it touted to be one of the most evidence based. They talked about the fact that they were developed from a curriculum that was comparable to Harvard Med and it was research focused. So I got involved politically, and before I knew it, we were going to Washington D.C. and running around to Senate and in the House and knocking on doors and saying, "Hey, can you help us um, properly fix what Medicare isn't doing for the public and for chiropractors?" I started young.
Yeah, that's amazing. It's funny, we have a similar background. I had never been involved in anything in high school, junior high, or even in my, pre-chiropractic college. Never, ever even thought about that. I was having too good of a time playing in the band and, traveling on the weekends and life was good. And I go to chiropractic college and I'll never forget my colleague's name, Dr. Stephen Westhoff. If you're out there, Stephen, big shout out to you because it was our first day in the class and we were we were trying to get people to run for class president. And Stephen, for whatever reason, I'd never met this guy, but he nominated me. And holy cow, I had no idea that I would thrive in that role. And, went from being the president of our class to the school and then ACA, all of the things up to the what's the group that's the chiropractic students. They have a congress or something to
Yeah,
that. Yeah.
yeah,
Anyway, I can't recall the name of it. It's been too many years. 40 years is a long time ago. Uh, but it was that similar path. It's like, wow, I didn't know I had this passion and the available, the ability to, I guess, influence people to have conversations with them and deal with the things we were dealing with at that time. And, here I am 40 some odd years later, and I still have a hard time saying no or raising my hand. Um, Let me ask you this, because this continues to bother me just as a fellow chiropractor. When I look at the level of participation of our doctors in their state associations and even more so in the national associations, depending on whose numbers you read, we throw around this number about 25% of the profession belong to either group. Why do you think that our profession has such a hard time or is so resistant or apathetic, if they are, to joining? And if they don't want to run and don't want to be in these offices and try to do the advocacy, why wouldn't you support those that are working on your behalf? That seems to be a disconnect for me. I just don't understand it.
I agree with you, and I also don't understand it. When I raised my hand to be the class student rep, um, I wouldn't say that half the room, certainly not 75% of the room, raised their hand, right? It was more like, oh, thank God someone's going to do it because I don't want to do it. And there's two things that come to mind. The first thing that comes to mind is I recently I did a search. I did Google and AI on top incomes of healthcare professionals. And so I started off with top five. Chiropractic wasn't in it, expanded it to 10, still not there, 15, 20, 20, still not there. We don't rank in the top 20 as desired professionals from an income-based profession. So that could be one reason. And part of that reason is the prejudice that happens when it comes to providing the American public access to chiropractic and for chiropractors getting being able to bill and perform the services that fall within their scope. That's part of it. There's also maybe a rebellion nature to chiropractors, right? Like we're
No.
we're we're one or two generations away from it being the norm to go to jail. And if you get involved at a world political level and you go some of the world delegate meetings, that still goes on right now. There's still chiropractors in their countries going to jail because either they're not legal, which is one thing, or they're illegal, which is a separate thing, right? But if you don't have regulation and you don't have some sort of pathway that you are real, you're legitimate, then that might tie into the rebellious nature of a chiropractor. And then, there's an apathy in getting involved. And it's crazy, Dr. Foxworth, because if we could just get everybody involved, we'd have the momentum, the energy, the enthusiasm, the finances we need to get the very thing to put us in the top five careers in healthcare.
Yeah, no doubt about that. So, battle cry to everybody out there, saddle up, join the fight. We need everybody that we can to participate. So, I've clearly we've been talking about Medicare reform for 10, 15 years now, probably since the year after it passed, if we're honest. Um, and a lot of chiropractors say, "Oh, I don't even want to fool with Medicare. I just don't want to see them as too much hassle, too much risk with the fines and penalties if you do something wrong." And I go like, "Well, that's only the single largest payer group out there is Medicare, and probably the single largest source of patients. So why wouldn't you want to be involved in it instead of? I mean, you're basically turning away a huge population if you're not involved in it." So for those that feel disconnected from Medicare, from policy, why is it so important that we make a change with Medicare?
Yeah, it's so multifactorial, but let's focus on the top down element. Medicare is a framework and it's a guide for what the commercial insurance is, the individual plans. the privately funded plans, they're going to follow quite frequently what happens in Medicare. And if we're not even recognized within Medicare as being able to be reimbursed as physicians, except as it relates to as Medicare says the manipulation, then why would the other insurance companies do this? So it's really, really important, from a Social Security standpoint, from a CMS, that's Medicare standpoint. A chiropractic doctor is a physician. We're a physician, right? And I'm not trying to say I want to be an MD or a DO or a dentist or podiatrist. I want to be a chiropractor. But we have physician status, and that's the top tier healthcare provider. So that needs to be consistent and reflective of the fact of what our training is, and frankly, what we bring to the American public. It's that critical.
Yep, no doubt. Uh, for years, we've said as Medicare goes, so goes the rest of the world, and so if you can fight these state battles till you're blue in the face, but if we can get Medicare changed, I hope everybody gets the takeaway that that really is the linchpin. So yeah, we're referred to as physicians, but in name only, certainly not in reimbursement. And it's unfortunate for the Medicare population. If they worked else, if they've worked most of their life, they may have had chiropractic coverage and whoopee, you turn 65, you get your Medicare card, and guess what? It doesn't cover your exams, x-rays, and therapy when you go to a particular provider. And I don't know how you spell discrimination, but I would at least start there, you think?
Yeah. Yeah, yeah. 100% it is. You know, I mean, discrimination, prejudice has happened throughout our country's history, right? It's been a big battle. This morning, I listened to the Supreme Court talk about those facts and why the 14th Amendment is being looked at right now as it relates to the discrimination post Civil War for slavery. And I'm not trying to say that the plight of a chiropractic doctor is that of what individuals went through slavery and the Civil War, but prejudice is prejudice, and it needs to be looked at. It needs to be examined. Um, y- you know, Dr. Foxworth, you and I are have been around in chiropractic long enough where we've had a racial slur said to us. And I even had it said to me in a group of 50 chiropractors 2 weeks ago. And a racial slur is a racial slur. And so the slur is, aren't you a quack?
Wow.
Why would I refer to you as a quack? And just plug out quack and plug in any racial slur you want. I don't care what it
Sure.
is. Is it okay? And no reasonable person is going to say that's okay. But we go through this time where it's allowed, or somebody cringes or puts their head down, but they don't say anything, or they say, no, just go ahead and get on the back of the bus. It's
Yeah.
not okay, and we need to examine it. And now's the time for chiropractic.
Yeah. It's interesting that you've had that same thought that I have. When I look at the way the chiropractic college has evolved outside of the medical system, which is fine, but the reality is when you deny a group the resources they need, like the historically black colleges and universities, the students are gonna be behind. They don't have the resources, and so our profession has had to kinda do the best it could to evolve without all the federal funding and support that someone going through medical school does. And you have to ask yourself if you go back and look at what if that hadn't happened? What if we did have the funding from day one? Our colleges and schools and our reimbursements would be entirely different, I think. But because of where we've come from and how we've evolved over time, some would say we have, some would say we haven't, but the reality is this profession has had to get by with less than anybody else that's going into a healthcare profession, just in the surrounding support and the financial support of them, and so it's a damn good thing we're still here. As Jim Parker used to say, it succeeds because it's right. And,
Yeah.
despite all their attempts to, do away with chiropractic and all through the Wilk case, we're still standing, which is a good thing.
Amen.
So, for those that don't understand the full impact of this Medicare reform, starting to be reimbursed for exams, x-rays, therapy, rehab. What do you think if we could fast forward 5 years, let's say we get Medicare pass, 5 years, what do you think the profession looks like?
Hmm. Interesting. The, the hard part to predict is what happens after Congress passes the law, right? Because then we have to go into the administration, right? So, one thing that would be important to me for there to be an effect within 5 years is an effective date, right? Like certainly we would want to see that when the president signs it, that it's
Enacted
effective
upon passage. Yep.
exactly, right? So that feels important to me. It feels logical to me. So then what are the steps for enactment? Let's say that now we're able to bill and treat for what falls within our parameters of our training and our education and our scope. I think that quickly I think that quickly we see $100 billion dumped into the pockets of practicing chiropractors. Now that's going to raise up the median income. That's going to have a downstream. This isn't an immediate, but it's a downstream effect on the crisis that we're dealing with our chiropractic schools, right? Because now when the young person, their source isn't a book, it's Google or AI, they're going to Google, top 5 professions in healthcare. And, from a quality of life standpoint, there's no better profession than chiropractic, right? We're not buried in the mouths of decayed teeth and sick patients, right? We're not we're not telling folks that they're going to die from cancer. Like we have such a positive profession. So now there's a quality of life from being a chiropractor. You can actually make a respectable income. The enrollment goes up, and it's a complete U-turn for chiropractic.
Yeah. It's a link. It is the it's got to be solved. No doubt about it. So I understand, or I was really pleased to read about your law that you got passed in Nevada. I believe it was called AB 511.
Yes,
Can
sir.
you share that with us and let people know what it's about, what drove it, and how you see it impacting people outside of Nevada?
Yeah, yeah, for sure. This was a state association driven law, and we started prior to 2017. So what we are looking at is the big offenders were Blue Cross, Anthem, and United Healthcare, and it was a daily global rate, this capitated rate where one paid $34, the other paid $35, and then on top of that, you were capitated on the number of treatments. You know, does a patient arbitrarily need 6 visits? Well, I've seen a patient, get better symptomatically in 2. I've seen it take 25, right? So do we need 6 visits? Do we need 10 visits? Is it 30 visits? What's that magic number? Well, it should be chiropractic necessity, not an arbitrary number of visits. So we looked at that from an association level, and I was on the subcommittee for equality and parity in Nevada. Um, so we went to the Division of Insurance, and they said, lo and behold, there's a law in the book since 1984 that said a chiropractor shall not be reimbursed differently than other physician types, and they shall have no less treatments, aka visits, than other physician or provider types. Um, and then it said, and shall reimburse the patient. Nothing about being reimbursed by the insurance company. So that was our fight in Nevada. We had the framework of good language in place going back to the 80s. But as anybody on this call knows that's been practicing more than 15 or 20 or 30 years, the insurance industry was far different in the 80s than it is in 2026, right? So we worked with the Division of Insurance to try to get that enforced, and chiropractors were tasked to go back to the insurers to change the law. Bravo, and a shout out to United Healthcare. They changed the fee for service immediately. They got rid of the capitation and changed to fee for service, but they kept the cap in. They kept the arbitrary X visit treatments or cap in. Anthem Blue Cross said, we don't interpret the law that way. We believe we're in compliance. They're capitated at 34.
Yeah, there's a saying called, "It's always dangerous when arrogance meets ignorance."
Oh, so legislative session one, we go in, we try to get the law changed. What we're advised to do, and we hired a lobbyist, was um, change the elements that took out treatment for an illness was in there. We took that out. We took out we took out paying the patient and put in, pay the provider. And then we bolstered the paid equally as physicians and the number of treatments equally as physicians. And the first legislative session, we had our backsides handed to us. We were laughed out of the room, as we should be, because isn't it appropriate to laugh at somebody that's a minority that's being prejudiced, right? Why not call me a quack? So laughed out of the room for being a cracker quacker. The second session, we came in late and we got tacked on as pork. And the insurance lobby said, we'll pass the bill, but you got to cut those chiropractors out of there. The third session,
Wait, stop, cut chiropractic out of parity, just stop the coverage?
well, what I mean is we came on late in the session, and so we tacked on to another bill.
I
And
Okay, so not cut
yeah,
chiropractic out, but just cut
yeah,
off what they consider the ornaments on the bill.
that's right. Yeah, just get to the back of the bus, you guys. You guys can be a part of this. So the third time we took a run at it, which was last session, the 25 session, um, the Nevada chiropractors that had historically put up big dollars to pay for the lobbyist said they weren't going to put any more dollars in. They gave up. And then the lobbying group said, "Yeah, we don't know if we're going to be your guys on this one." So I just said, "Gosh, we're going to do it on our own." And I had a colleague, an attorney colleague that works personal injury as a lawyer, and we'd done some cases together through the years. And I called him up and I said, "Remember that one time that we had that one case that didn't go really well, and we had we needed to, everybody needed to make adjustments in our bills and our treatments, and remember that happened?" He goes, "Yep, I remember." I said, "Okay, well, I need a favor back." And he happened to be the speaker of the assembly. And I said, "Can I give you my 5-minute elevator pitch on why prejudice is not okay in America?" And I did, and he goes, "Okay, I agree with you. We'll get you in." And we got a standalone bill, and we got through committee with assembly, and then they brought us over to Senate. We got it through Senate, and then back over to assembly again. And before we knew it, we had passed unanimously. And then we had about 6 weeks where the governor didn't sign the bill, end of May through into June. And I was so nervous, but finally he signed it. So AB 511, chiropractors, and we changed chiropractor to chiropractic physician, but we did that to be in alignment with what federal law, Social Security Act, CMS said.
Right.
Chiropractic physicians shall be paid equally with other physician types, and they'll be not limited in the number of treatments or visits to other physician types. And for treatments for their scope, not for an illness, because we don't treat illnesses. And the provider or the patient can be paid directly. And so that passed, and it was enacted January 1. And so we went to the Division of Insurance, made the case to them, and they said to me, quote, "I think I'm going to throw up. My stomach is so upset. I can't believe the insurers have been doing this to chiropractic all these years. This is egregious. We are going to take up this case." And
Wow.
so right now, we've had to file complaints against all the big ones. And we're right in the middle of it. We're right in the middle of investigations and enforcement because God forbid you just say you're right. We're going to follow the law.
Yeah. What a concept, huh? I couldn't help but smile when you were saying it took us 3 years. For those that have been involved in this advocacy world, the reason it takes 3 years, a minimum, to get a bill passed is you gotta pay off the House, you gotta pay off the Senate, and you gotta pay off the governor, and that takes 3 cycles. Now, that's not true. Nobody ever brown bags. Uh, I'm telling that story because back in the '60s, when my parents started practice in Mississippi, you couldn't even get a license. And so the way things got done way back then was all the chiropractors put cash in a bag and drove to Jackson to have dinner with the senators and the representatives. It was just the way things were done. Uh, The real takeaway though is it's not what you know, but who you know. And that's why I encourage all of our doctors, get out and be involved in your community, be involved in the local elections, because the guy that's running for dog catcher today could be running for Congress tomorrow. And the more you connect early on with those people,
Yes.
it is a game changer. And because you've got relationship rather than just going in there when you need or when you want something, and it makes all the differences in the world. So the bill passed, but yet the insurers are dragging their feet on implementing it, or they've appealed. Have they filed an action saying they don't have to follow that?
No action filed thus far. We've got a reply back from Aetna to the Division of Insurance, where they, in effect, say, we believe we are in compliance with the law. Can you provide proof that we're not? And the proof's already been provided by the association. Um, Blue Cross has responded privately with the same message they sent many years ago, and that was, we believe we're in compliance with the law. So we're now in the hands of enforcement and going through those slow steps. The great part about having an enactment date is that if 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 chiropractors are found to be in the right, and if it supports the position that I believe this language changes, then we get to go back to January 1. And you know what else, Dr. Foxworth? Who knows? Maybe we get to go back to 1983 or 84. Wouldn't that be
That'd be
cool?
sweet. Make money the old-fashioned way. Sue the hell out of somebody.
That's right.
So you've served with the ICA now. You're vice president, as I understand. You've been on the National Board of Chiropractic Examiners and multiple state boards. What's the biggest misconception you think that our average chiropractor has about advocacy and getting involved?
Gosh, it's such a tough one. I think the biggest misconception is I don't have time. And the other thing that is really interesting to me, so I cut my teeth with association in the early 2000s in Nevada. Association is usually the path to regulation. Once on regulation, regulation is the path to getting involved with the Federation of Chiropractic Licensing Boards, the National Board of Chiropractic Examiners. But there is an opinion sitting outside of what those organizations are versus the truth of once you get in. Um, and there's no glory, there's no fame, there's really no accolades. You're in there working, and you're in there serving this profession. And so I I guess people just don't understand how much you have to give, because you do your day-to-day practice, and then you go and you do these other one or two or three jobs.
Yep. Back in the day when I was in practice and very involved as our state president in legislative efforts, there have been more than several occasions when a bill was coming up, and I would literally have to leave the office with patients on the table because they called us to testify. You think, "Man, that's a horrible thing to do to your patients," but the reality is the efforts that we put in to do that really does end up serving the patient in the long run. Minor inconvenience or major inconvenience for them, maybe so, but getting involved is not an option to me. It is an obligation. And people have asked, well, what have you gotten out of chiropractic? And I said, I have gotten everything that is good in my life as a result of being a chiropractor, being involved in it. And so why wouldn't I do what I do what I can to leave it better than I found it? It's just we just need more shoulders at the wheel, Jason.
Yep, yep, 100%.
Well, hang tight, everyone, while we take a quick break to hear from our sponsors. Welcome back to our podcast with Dr. Jason Jaeger. Enjoying the conversation here today. So let's pivot a little bit. I want to talk about your dad and the neon signs. Who would have ever thought there would be neon signs in Las Vegas?
I
And that's a
know.
segue into your universal tracking system. I'll connect the dots.
Yeah, yeah. So, all right. My paternal family are Bavarian immigrants, and my maternal family are Welsh and Manchester immigrants. So my mom's side of the family are Mormon, they're LDS, and they moved right out of Europe into Salt Lake City. And my great grandfather, his nickname was Boo Young. Thomas Young Sr. started doing blowing neon. In the late 1800s, early 1900s in Ogden, Utah. Well, fast forward, my grandfather marries his daughter, his oldest child. He just finishes liberating Germany in World War II. He's coming back to Salt Lake City, and his father-in-law, great grandpa Boo, says, "I'm going to put you to work in the neon sign manufacturing business." But there's this new small community called Las Vegas, and some guys from Chicago are moving out there, and they're going to build some gambling saloons, and we think we can build them some signs. So so the Young family and the Cannon family and the Jaeger family all start to converge on Southern Nevada and on Las Vegas and get involved in the neon sign manufacturing business.
That's interesting. So tell us about the universal tractioning system. For those that aren't familiar with the technique that you use, what is it and what problem were you trying to solve when you put that together?
So so the problem I was trying to solve, it goes back to that defining moment with Stephanie Youngblood, where Stephanie said, "Jason, your neck looks like this. You got in a car crash and it should look like this." And then she said, "I'm going to do this with you to get your symptoms under control. And then I'm going to do this with you to fix you." And so we do the post x-ray and it doesn't fix me. And I go, "Well, okay, well, why don't I just seek out the most evidence-based chiropractic school in the country, and I'll go there, and then I'll learn what I didn't have happen to me, and then I'll be able to fix me and fix other people." That path brought me to chiropractic biophysics. So chiropractic biophysics said that the adjustment wasn't a long enough moment to make a permanent change in alignment consistently over a large enough sample group. Okay. Well, great. So then I thought to myself as a kid that played sports in high school, well, it must be working out. I just have to exercise my neck back there. Well, the exercise wasn't it either, although isn't exercise good? Well, yeah, of course exercise is good. So the concept was like braces. If your teeth are crooked, you can't do that to change the alignment, but you can put braces on them and it'll change the alignment. And some folks, you get braces and your teeth are perfect the rest of your life. Some folks have to wear a retainer.
Hmm.
So chiropractic biophysics brought forth a theory that you need to do the adjustment for the neurology, the neurological element of the finding. You need exercise to strengthen the surrounding tissues, and then you need a sustained force load over time that will change the alignment, change the ligaments, and that synergistic effort would permanently change alignment. And fast forward, we're at 380 papers in the peer-reviewed literature in medical journals, radiological journals, chiropractic journals, physical therapy journals, multidiscipline, a big amount of evidence. But as I'm just starting to practice, that evidence is new and it's young. And I'm looking at what chiropractic biophysics doctors are using for equipment, and it was embarrassing. And it didn't do everything that needed to be done because the spine isn't just the neck and the spine isn't just the low back. It's one structure. It goes from nose to tailbone, and we need to be able to treat the entire structure because it's one thing. And I draw back on my neon sign experience, working as a kid as a welder and electrician and cutting sheet metal and all those things. And I said, gosh, we should be able to build a beautiful piece of equipment that looks like the gym, that looks like something that the public can relate to, that doesn't just do the neck or the low back or the mid back or one thing. And then I hated in chiropractic school that doctors would name orthopedic tests after themselves. So I didn't want to call it the Jaeger special machine. I'm like, well, what does it do? And it universally treats the entire spine. So thus we was born universal tractioning systems. And it's a piece of gym looking equipment that a patient can exercise on and then passively sit in and will reproducibly, consistently, from a peer-reviewed evidence-based standpoint, permanently change the alignment of the spine back towards a.
That's pretty impressive. What are typically people who invent things and make things better, they don't usually stop at one. Is there anything on the horizon that you're working on that you're in a position to share?
We've got 3 other projects, so 4 total. Obviously, patent is still pending for universal traction systems. We did develop a lumbar specific device, so that's out and on the market and has a patent pending. We also there's been a chiropractic adjusting table that's used for corrective care chiropractors, used by corrective care chiropractors for decades, the Omni table. And virtually everybody on here knows about the Omni adjusting table. Um, Deed Harrison and I have redesigned and redeveloped and made better a newer version of a mirror image adjusting table. We actually just were granted that patent within the last month. So we've
Congrats.
got a patent on a chiropractic adjusting table that we hope can be in chiropractors' offices and chiropractic schools around the world. And then finally, about 13 years ago, I brought in medical doctors and physical therapy providers, and I told them that there's a better way that we could work on doing healthcare together instead of sick care apart. And so we all came in and collaborated, and we've approached healthcare from a proactive standpoint, but as it as it relates to what our different license types can do. And we've got a patent pending on that integrative method.
Awesome. That's great. So after decades in the field, what's the one lesson that has fundamentally changed the way you approach health and healing with your patients?
Wow,
You
that's a
had the aha moment early on, but since you got into practice, anything that came along that said the light bulb went off?
interesting. Being there for the patients, listening, talking, and then adapting to what the patient and what the findings bring was probably my biggest change from maybe the algorithms they tried to teach us at school.
Got it. So I've got some just for fun questions as we wrap this up. Are you ready?
Ready.
What talent do you have that most people don't know about?
I love to karaoke sing.
No kidding.
Yep.
That's awesome. Can't wait to where we are somewhere and I get to hear that. That should be fun. What time of the night do you usually karaoke sing? 'Cause I think there's a direct line between the time in the evening and the time that karaoke artists step up.
Yeah, I would say irrespective of what time zone I'm sitting in with worldwide travels, it would be between the 8 PM and 10 PM hours when the microphone comes out.
Good deal. All right, the next one is who's your hero and why?
My grandfather, Von Cannon Senior, he was an integral part of raising us. He's the one that brought Yesco to Southern Nevada. We spent our entire summers with him, and as kids, we always wanted to hear war stories, and he would never tell us war stories ever. But he would kind of look off in the distance when he asked. Um, as an adult and as a practicing chiropractor, just barely starting, I watched Saving Private Ryan, and I watched the beaches of Normandy get stormed, and I burst out into tears reflecting back on all the years that we pestered my grandfather for a war story, and I
Yeah.
understood why he never told us.
Jace, when I had the opportunity to start the chiropractic program here at our local VA 10, 15 years ago. Absolutely some of the best time that I ever had in practice because for once I was able to take care of patients and they didn't have to worry about the money. I didn't have to worry about the money. And uh, the thing that struck and sticks with me the most is I was seeing guys that were in their 70s and their 80s in the Korean War, and they are still coming in for mental health therapy. The scars and what they have seen and what they have been through, they clearly last a lifetime. And it just it's heartbreaking. to see that, and you can understand why so many of the veterans coming back have a hard time adapting. It is a tough thing to see and a tough thing for them to go through. And thank God they were willing to do what they did. They just so kudos to your grandfather and to everyone else who has served. So, what's the worst job you ever had?
Laying concrete.
Man, that's a good one.
Yeah. Yeah. Whenever I said, man, am I tired from studying for a test tomorrow in chiropractic school? Man, isn't 26 credits per quarter or trimester so much? I would go back to saying, but I could be laying concrete.
That's right. Mine was I could be working in a catfish pond gathering the eggs from the containers while the boss sat on the top of his truck shooting the alligators that were in the water with me and the rest of my buddies. Yeah. Yeah. So the lot of different things can motivate you to go to chiropractic college. Yours was concrete, mine was catfish. Well, doctors, if you're offering discounts in your office, make sure you're not violating state or federal rules and regulations on dual fee schedules, inducements, or any kickback laws. The fines are no joke. Our profitable discount strategy keeps your discounts fully compliant and profitable. It starts with a free, no obligation call to see if we can help you, just like we've helped thousands of other doctors nationwide. Many of our docs have seen a 20% revenue boost and a 50% patient retention within our network. For 18 years, over 7,000 chiropractors have helped 4.3 million patient family members get affordable care through ChiroHealth USA. If you want more revenue, better retention, and peace of mind, call 888-719-9990 or visit CHUSA.com, that's CHUSA.com, to see why ChiroHealth USA is the network that works for chiropractic and you. Thanks so much, Jason. Really appreciate your time today.
Thank you. Thanks for having me on.